Hi, once again, Dr. Ibe, your platform medical advisor. I've had lots of queries on sickle cell anemia, sickle cell disease. I am very passionate about this topic because this has affected me personally. My late senior brother, who was a reverend, he had 6 children because he had a set of twins, and amongst these 6 children, 3 have passed on because they were full-blown sicklers. Only 3 are alive. Even as at that, one of them is still a sickler, but thank God she's made it. 2 are okay. So I am very passionate about this topic indeed. Now, the sickle cell is, of course, all of us know is SS, which is sickle cell disease itself. You have AS, which means you are a carrier. You don't have the sickle cell. And then you have the AA, which means obviously you are normal. Now, if you are SS and marry an SS person, either male or female, then your chances of there is a chance that all your kids will have sickle cell disease because both of you have the disease. If you're AS and you marry somebody that's got AS as well, you have 1 in 4 chances of having a child with sickle cell disease. You have chances as well of having a child with that's got AS, which is a carrier. Then a chance of having a normal child as well. It depends on the cross matches, which is AS, AA, SS, and AS. And if you are AS, then you marry somebody that's got AA, you also have a chance of having a child that is a carrier but does not have the disease. So or your other kids may be normal. Okay. So in the UK, for instance, or in fact all over the world, we do advise if you have a child that is a sickler, you have to make sure that the child is up to date with his or her immunizations. That's very important. You have to make sure that the child is on regular penicillin, which is antibiotics. That's very important. They have to be on folic acid as well. That's very important. Obviously, on pain medications, maybe ibuprofen or paracetamol syrup. Okay, these kids must have these medications on regular basis, all the time, really. And obviously, watch out for crisis, temperature, feeling unwell, pain all over. And I would equally advise that you have to make sure that these kids are under a pediatric hematologist so that they will be reviewed regularly. That is very important. I have lots of patients with sickle cell adults that've got children. Some of them, from time to time get into crisis, just with pain, bone pain, temperature, are feeling unwell. We just put them in as inpatients. Some have made it, they're having kids now. However, the treatment should really start as a child when they are kids. So yeah, please make sure that these kids have they are covered. They have their immunizations. They have their regular penicillins, folic acid, and pain medications, ibuprofen, and or paracetamol. Okay. I would lastly advise genetic counseling before you get married. Make sure that you know your genotype, you know your status. Your partner, he or she, must equally know his or her status. Genotype counseling is very important before you get married. You don't want to marry somebody. You guys know that definitely your kids will be sickless. It is it's a painful experience to have sickle cell children. It's very painful and sad indeed. Some of them do pass on, and it's very, very sad and can be traumatic. Okay, so I felt I addressed this issue. And once again, please take care of yourselves, be good, be safe, and play safe. God bless. Bye.